I'm Dr. Lisa Chong, your tongue tie and TMJ specialist. I'm based in Sydney and welcome to my YouTube channel. Today I'll be talking about tongue tie. Now, what's the implication of tongue tie? When the tongue is tied, there's this attachment that's really thick that's attached the tongue and position the tongue in a low position, and most of the time the patient cannot put their tongue out and cannot put their tongue on the palate, and sometimes it can affect the speech, and sometimes in baby situation it can affect suckling, nursing, and sometimes it can affect obtaining certain functions such as pronouncing words and doing certain things with your tongue. It will be very difficult to lick an ice cream, so a tongue tie would affect the development of the jaw because the tongue needs to rest on the whole part of the palate, and the tip of the tongue needs to sit where behind the incisors, front tooth of the incisors back here. So when you have your tongue sitting on the palate, it develops the palate, and it is essentially developing the floor of the nasal cavity as well. So it is so important that the tongue sits on the palate to develop it and expands it so that the nasal passage is clear and you can develop the breathing properly, so there isn't any airway obstruction. So in my past video, we talk about airway obstruction, but this video, we talk about the importance of the tongue in developing the arch, especially the top arch. Now, when the top arch is developed by the tongue, it grows to an ideal size, and then your teeth sits properly, it doesn't get crowded. When the tongue does not develop the palate tends to be a V-shaped tent like so. And when it's a V-shaped tent like so, it also kinks up your nasal bone. When it's kinked and deviated, it causes part of your nasal passage to be obstructed in some ways. So that could also contribute to airway obstruction in particular side of your nose. The tongue as well needs to be postured in the right manner at all times. When the tongue sits on the roof of the mouth, it sits higher. It allows you to have a nasal breathing. When you're sealing your lips and you're breathing to your nose, you're standing upright. So basically, when the tongue is on a low position, which is down at the bottom of your lower jaw, if that's the natural position it's sitting, then to breathe, you're actually compensating by posturing your head forward like this. So this is how you posture. This has a physics torsion. So your neck is actually having a lot of torsion stresses onto the neck muscles when you're having this forward head posture. So when you're noticing that you're having a forward head posture like so, just be aware that what is it caused by? Is it because you're breathing through your mouth? Is it because you have a tongue tie? Or is it because naturally your tongue sits at a low position and it doesn't sit on the roof of the mouth? Is there an actual obstruction behind the pharynx region? Is there a problem because you're developing this tongue posture from not able to strengthen the tongue? Sometimes it's not just the positioning or the tie. Sometimes the tongue has an issue with its tonality of it. The tonality of the tongue is important as well. So if the tongue is weak and it doesn't actually sit on the palate naturally, or even function naturally, or it has abnormal activities like tongue thrust when you're swallowing, then you might develop all these problems with crooked teeth, jaw alignment that's misaligned. Let's say, for instance, when you're swallowing, you tend to swallow on the right side and your tongue is thrusting on the right side, like so. Then your jaw might be misaligned towards this way. And if it's misaligned towards the right or towards the other side, you have this discrepancy with your midline, and you could position yourself this way. And misalignment of the jaw is also one of the common TMJ dysfunction. Thank you so much guys for watching this video. I hope you have some information that's useful to you, and I hope to see you in the next YouTube. Bye bye.